September is Suicide Prevention Month, and the California LGBTQ Health and Human Services Network is doing some really great work right now. Can you share a bit with our audience about your organization?
Yeah, absolutely. So the California LGBTQ Health and Human Services Network is a statewide organization that works alongside, community-based organizations, researchers, healthcare professionals, and also very closely with, state politicians and leaders to help advocate and improve health equity efforts within California. I know many folks may have the generalization that because we live in California, all LGBTQ people are, equally treated and well cared for and have gender affirming care, but that's definitely not the truth. So, we're definitely still making um, progress towards that and making changes alongside our partners, specifically around really two big projects around tobacco use among LGBTQ communities. One of them is called We Breathe, and the other is called Out Against Big Tobacco Los Angeles, which centers more focused on lowering the LGBTQ health disparities when it comes to tobacco use in Los Angeles County. And we also, work on passing policies to help improve LGBTQ health in California. And yeah, that's we also provide trainings for folks who are interested in, learning more about LGBTQ health issues and whatnot. We also host a statewide health convening that was actually just held last month in August, that brings together over 200, community leaders, folks that are just interested in helping to improve health equity issues among LGBTQ folks in California as well. That's a little bit about the network.
Yeah, and some really, really great work there too. And when we look at research from the Trevor Project, which is very recent, it shows LGBTQ plus teens are at an increased risk of mental health issues and the risk of suicide. 1.8 million LGBTQ plus youth consider suicide every year, and there is at least one suicide attempt every 45 seconds. Can you speak to some of the challenges that queer youth are facing every day, both at home and even in school?
Yeah, definitely. I feel like LGBTQ youth definitely face significant stressors, even starting within their family homes of unaccepting families to even like, in places where they should feel safe, like at school, oftentimes facing bullying and just, discrimination and trauma that, really shouldn't be placed on anyone just because of their identity and who they may or may not choose to love and be romantically or, interested in general. I also feel like there's, just a lack of affirming mental health, care services in general with, many folks experiencing just, outright discrimination in the healthcare space, which is very, disheartening to hear since we already have a big history with just a lot of problematic practices that the medical industry has placed on LGBTQ folks in the past. So there's already kind of a lack of trust when going to seek that care. So I feel like youth specifically need to have that mental health care support because they face a lot of stressors when it comes to just not even being able to like financially support themselves at such a young age. They might not know who to turn to. So oftentimes they, might cope with substance use even to help with some of those stressors of internalized homophobia, of bullying, and a lot of the times it's nicotine or even tobacco, since that's very much becoming more easily accessible at that young age. They see their friends doing that. They see it's just equal, the flavors are very enticing as well. So, and in a way, I feel like nowadays you don't really have to say that tobacco can lead to death. I feel like everyone knows that. And, they could even be using that as a way of self harm because, they think that, their life isn't worth being existing here. So yeah.
And why is access to resources and care so important, giving those numbers that we just talked about?
Yeah, it's life-saving, honestly, just basic human, resources such as, food security, housing security, mental health access, gender-affirming care, that is life-saving care in so many ways. I feel like we're also not really, taught at a young age to practice self-care. So, folks may not know how to really check in with themselves and seeing how their mental health is that day. So, yeah, it really starts with just just giving people the basic resources that they need to live. Um, so yeah.
Yeah. And over 80% of LGBTQ plus youth wanted some form of mental health services over the last year, but over 56% of those youth could not get that access to the care. How can we expand coverage and improve access to protect our youth? This is literally our future.
Yeah, that's a great question. So here in California, we're, striving to make those changes. Just last year, we passed the TGI Inclusive Care Act, which essentially implements training protocols for all healthcare professionals in being trained in LGBTQ competency, and even starting to create directories more specific to different identities within the LGBTQ community. One of our partners, Still Bisexual, created a bi plus therapist directory because bi plus folks are significantly put at risk for suicide due to bi erasure, due to higher risks of mood and anxiety disorders, substance use, and suicidal behaviors or ideation. And so even having those resources available, passing legislation, creating those resources internally within your organizations, and making sure that those resources are available and seen and made accessible to folks, I think is super important, because yeah, that number is super high and definitely shouldn't be the leading cause of death amongst LGBTQ folks, since, like I said, it's just a matter of having these basic resources that folks deserve and need.
Yeah. And how much can support and acceptance, at home and in school do for our LGBTQ plus youth? Research says that is critical to better mental health.
Yeah, it is significantly important. I know for myself, even having one adult that I could openly talk to or confidently share my identity or experiences with made all the difference, right? And um, I think oftentimes we really hold those parts of ourselves, uh, internally, and don't really feel comfortable sharing that because of stigma, because of a lack of understanding. Um, and so I feel like it makes all the difference just to have, that one supportive person in your life that is just, willing to uh, you know, uh, hear you out and just, yeah, be there for you in support where other resources may not, right? Like, access to mental health is also just a, a privilege, really. And a lot of folks don't have that, insurance to afford even seeking out a mental health care professional. So, um, and also, adding to that, just like having, better coping mechanisms for youth. I feel like we need to really invest in community-based organizations that provide safe spaces for youth, because that alone can really, create a community for folks to create more supportive communities and people that they can lean on for support when other resources that should be available aren't.